Hi guys, I'm Dr. Tara Tobias, neurologic physical therapist here in Orlando, Florida. I want to welcome you all back to my channel. I'm super excited to share this video. It is something that I encourage all of my patients to do at home to perform all of their home exercises. I talked about it a little bit in the previous video, but it is a setup that I feel like everyone should have in their home. If you have suffered a stroke or you have any kind of hemiplegia or weakness or injury to just one side of your body due to a stroke or a brain injury, and that is how to use a mirror to really drive that point home in your brain of where middle is and to really teach your brain how to do things symmetrically. So this is for anyone who has any type of midline orientation issues, which is pretty common after a stroke or a brain injury. If you notice that you always have your head slightly turned to your uninvolved side, we call that like a midline orientation issue. Or if you notice that you're always kind of slouched to one side, that could also be an issue with knowing where the middle is exactly. Or if you look in the mirror and you just see that your shoulders dropped or you're rotated at all, that would be another issue where this is an absolutely essential part of your home exercise program. I'm almost mad at myself that this wasn't one of the very first videos I did because it works so well and it is super valuable to any home exercise program. So basically what I do is I just set up a mirror and I divide it up into quadrants. So there's two things that are usually a little bit off after a stroke or a brain injury, and that is one, knowing where the middle is side to side, and also keeping everything parallel to the ground. Keeping your shoulders parallel to the ground, keeping your hips parallel to the ground is always a huge problem. And that's either because one side's either activating more than the other side, or again, some of the midline issues that I talked about. So I take a mirror and I just put a little weight at the bottom of these straps. I have a lot of these straps in my clinic, so I use them for a lot of different things. But I put a little weight at the bottom of it just so that the weight just kind of makes sure that it's completely vertical. You don't have to do it that way. If you're going to set up a permanent spot in your home, you can go ahead and just put a little piece of tape down the center of your mirror. And then I take a second strap and I try and make it right at shoulder level. This one I wouldn't make it a permanent line, because whether you're doing standing exercises or sitting exercises, you can move this horizontal strap, but basically that's going to ensure that when you're doing your exercises, your shoulders are level, which is what we're going for. And then this is the key part, is that you are going to put something on the floor for your feet, and you really want to make sure that one foot is on either side of that line. That is critical, because if you position yourself, and you'll see what we're going to do, but if you position yourself off to one side, then these lines aren't going to do anything for you, especially the vertical line, or the line that goes up and down. So that foot position, making sure your foot position, you have one foot, each foot is equal distance from the center of that line, is critical. And then to start, if you have really bad body awareness or you have a huge neglect, you're just gonna sit in front of the mirror and work on with your feet on those spots, and that center line, that center strap, when you look in the mirror, goes all the way up, directly up the middle of your body. You wanna make sure that it's at the middle of your chin and it intersects the middle of your nose as you're looking in the mirror. Now, it's pretty common that you might be shifted off to one side, your shoulder might either be dropped down, or in some cases, the involved shoulder pulls up. That's one of those spastic patterns that I talk about a lot. So the first step is just, can you get to that middle position? And can your shoulders line up with that horizontal line, with your nose and everything else lined up with that vertical line? You should have equal parts of your body on both sides of that vertical line, and both shoulders should be level with that horizontal line, and you're just gonna hold it. And as I had mentioned earlier, this is a great setup to do all of your exercises. So with your body in the middle, now you can do some exercises like I've shown in other videos where you just clasp your hands and you reach overhead. But now you're really making sure that when you're reaching up with those hands and you're working on your shoulder range of motion, that you're keeping them directly in line with that vertical line as you bring them up, that you're not bringing them off to the side like this, that they're staying right in line. And that's gonna just help to drive home that point of activating both sides of the body evenly or equally. So I just show that you can do this with a variety of exercises. You can see over here, it's kind of hard to see, but that I also do the cane exercises. I'll put a link for that video in the description where I go through a whole series of exercises using the cane to work on reaching. But again, I've got two focuses now, so occasionally I'm gonna check in and make sure that my body is staying lined up in the middle, that when I reach, I'm not reaching like this and my body is twisting, because now I have that line to make sure everything stays straight and that I can maintain my core, my trunk stability, and just move that arm. And then you can do the same thing out to the side. Again, it doesn't show these exercises really well. That's why you should really watch that video that I referenced earlier where I go through specifically focused on those cane exercises. But just showing you that you've got that additional feedback in this position of the mirror and the lines to make sure that you're really doing good quality movement and that you're not compensating with any kind of trunk rotation, or you're not leaning to get that same movement. And then once you get really good at that, you can work on getting out of midline. And then can you bring your body back to midline? So you could almost challenge yourself a little bit and not look into the mirror until you think you're in the middle. Maybe close your eyes and then open your eyes and see, did you get to middle? That's a great way to progress to, could you start carrying this over into other activities where you don't have that mirror, that feedback in front of you. You always want to start with a lot of feedback whenever you're learning a movement. Mirror, you know, in therapy, a therapist giving you a lot of cues and a lot of corrections. You always want to start with a lot, but truly learning a movement, you got to start to take away some of that feedback to really learn a movement. So it's always great when you're at the beginning of learning any type of movement to get a lot of feedback and then slowly start removing it. So that's one way you could remove it on your own, is just close your eyes, get back to where you think middle is, and then open your eyes and check yourself in the mirror. And really, the sky is the limit. You can go on and do some of the standing exercises that I've shown and some of the weight shifting and weight bearing. This is a great setup for that, because of course you need to learn how to shift over one leg and bring your body back. But that vertical line in the middle will really help you to know when you're shifted and then bringing yourself back to the middle. There's a ton of things you could do with this setup. So very cheap setup that you can do in your home. That last exercise I showed last week, where I said that there were some additional things that you could do to really make sure you were getting that crunch, that abdominal movement, that trunk flexion that I showed in the last video. There's a link for that right here. You know, adding this mirror is just another way to make sure that you are activating those muscles at the same time and getting that good symmetry. And that is it. I hope you guys found this video helpful. I hope that you all decide to incorporate this into your home exercise program. If so, share in the comments of how it's going. Just encourage, might just encourage someone else to go ahead and do it if you found it helpful and you're using it at home and it's working for you. And that is it for today's video. Go ahead and hit that subscribe button, click that notification bell, give it a thumbs up if you like these ideas of homemade products that you can use to kind of create your own home gym. If you have any questions, comments, concerns, please leave those in the comments below. Before you let this video end, go ahead and give yourself a pat on the back. If you're sitting here and you watched this video and you made it through this video, you're motivated and you're determined to get better, and that is 90% of what it takes to get better. So just keep working on that 1%. I thank you all for watching, and I look forward to seeing you all in the next video. You all have a great day.